This is Dr. Scanamayo coming to you from elderparentcenter.com, where we are helping baby boomers and their parents live longer and better. Today we have a daughter who's bringing in mom. Mom has dementia and the daughter states, I just can't keep her dry. This is a typical scenario for functional incontinence. It is where the brain does not get the signal or the message from the bladder screaming and saying, I need to empty. The good news is that this is almost always manageable. What are some of the causes? In this case, we have dementia, but also stroke can do it. If there is a physical problem, extreme weakness or debility or arthritis, if there's a barrier in the environment, for example, long hallways, lighting, or staircases, that can cause this problem to occur. The bad news is that the bladder will usually empty at the most inopportune time. We always have to realize that the loved one is usually not aware of this, and we should ask them whether or not they have the urge to go to the bathroom. Very important to know if they do have the urge, then we can work with them and have a greater chance of keeping them dry. The first step, as always, go to the medical doctor, local physician, and find out if there's an infection. He'll look at the medications, realizing that sedatives, narcotics, and behavioral medications increase the chances for urinary leakage and decrease the ability of the person to get to the bathroom on time. The second goal is to keep the bladder empty. How do we do that? Improve access to the bathroom, better lighting, exercise for the lower extremities will help the person be stronger and more agile. And believe it or not, walking has been shown to increase the sensitivity of the person to the bladder being full. When they're in the bathroom, make sure they have grab bars, high toilet seats, and elastic waistbands on their pants instead of snaps or buckles. This will help them undress more quickly. When we have to keep the bladder empty, we can do it on a toileting schedule. For example, every 2 hours, get the person to the bathroom, sit them down, turn the water on, regardless of whether they want to go or not. If they're on a road trip, stop at the bathroom at least every 2 hours. This will also help decrease the risk of blood clots when people get out of the seat that they're sitting in for long periods of time. Don't forget that fluid intake is important. Every 4 hours, you should be drinking something, but usually we recommend for older people not to drink pure water. This can change the electrolyte balances in the body, which we can discuss on another video. And don't forget pads, diapers, and bed liners to help eliminate the possibility of wetting or wetting the beds. Thank you.